Hello, this is Dr. Lewerenz at Longevity Health Institute. This is one of our cards that we send out. I write little notes on them to patients. All our new patients get these, and I occasionally handwrite them myself when we're working on something and to motivate people, and if there's some issue that I want to make sure I press home. And we mail these out to everybody. But what is my point about this? Welcome to Better Health. Well, my point is I want to talk to you about the pandemic and COVID-19, and you've probably watched some of my other YouTube videos and seen some of my information here that I share with you and my thoughts. But I want to share some things with you and actually share with you some studies out of the Journal American Medical Association, JAMA, and a New Well Health survey, which is one of the biggest health institute surveys in New York City related to COVID-19. And I think our approach is wrong, and I can't share with you on a YouTube video what my approach would be, but I want to share with you my thoughts about how we can make and take a paradigm shift in our healthcare system approach to really change and alter the approach to our healthcare system, but that would stop future pandemics like this and future diseases that cause early death and suffering, and really have an impact on quality of life and health, and actually would save billions of dollars worldwide, and including in our country. If you want to know my personal approach to COVID-19, you got to be a patient and come in, and I'll share with you in a room in person. But anyway, so let me share with you though. So this is a journal, a medical journal came out. It's a publication, and I'm trying to make it brief, but you can see here some statistics it shares with you, and these are in journals in Lancet and Journal of Medical America, JAMA, the Journal of American Medical Association, and also a study, and I'll give you the exact number here, that was performed between March 1st of 2020 till April 4th of 2020, involving 4,729 individuals in the New York health system. So in these studies and in this combination of data, 41.7% of patients that are hospitalized with COVID-19, 41.7% actually had BMIs greater than 30, which means obesity. And that's a subjective kind of, and that's a whole debatable thing, and I could share with you, but the point is they were overweight, and most of them probably obese. 33.8%, 33.8% of, in the same study, had type 2 diabetes. So they are obese and had diabetes, at least 40% of the individuals that were hospitalized with COVID-19. There was another study that was, again, in this New York health system that showed that there was a 6 times increase in risk of type 2 diabetes in people that were tested positive for COVID-19. So this is all in a medical journal, actually, and this journal actually has a combination of data, and this data was produced in Family Practice News, which is part of the American Medical Association, and a MD Edge, which is a publication network. And so these aren't numbers I'm pulling off the top of my head, they're actually done in a study. And what I want to share with you is something that we know and you've heard about, but it's real stuff, and I will share with you, unfortunately, I've had 2 patients recently that have been hospitalized, and one of them very severe and actually put on a ventilator because of COVID-19, and he was over the age of 65, he was diabetic, he was obese, and he had other health conditions too. And I think that hugely impacts the effect with immunity and the effects and aggressiveness of COVID-19. Now, but here's the thing is, and here's the take home and what I want to share with you and why I mentioned this thing about welcome to better health. What do we do here? Well, every patient that walks through our door, we take a complete medical model that is a functional, personalized medical model. And when you look at functionality and you look at true physiology and you look at how the body works, whether you're a couch potato, you're my 25-year-old professional athlete, my my stay-at-home mother of 3 or 4, yet she trains and goes to the gym and kind of kicks butt every day, or you're my business owner, businessman, or you're my blue-collar patient that works 9 to 5. Okay, I'm talking all of them. We always focus on, are you insulin resistant? What is your weight? What is your metabolic rate? Where should your weight be? And what is your diet? And these things, because being overweight and not addressing it is an issue, because you're leading towards diabetes and you're leading towards obesity. And if you're obese, we got to work on that. And if you're pre-diabetic, insulin resistant, which is part of aging, you saw in another video I talked about this, 1% of our isolate cells are lost per year of life. So by the time you're middle age, you've lost around 50% of your pancreas effective making insulin. So we all become insulin resistant. So we're all on this spectrum of becoming type 2 diabetic, and we got to have a paradigm shift and really approach this in the healthcare system, because when we really impact weight, diet, and diabetes and the metabolic system, we actually impact your immunity and health. And in fact, essentially, people aren't dying and hospitalized, okay, from COVID-19, okay, because the majority of people under the age of 65 that have a decent immune system, that aren't diabetic and obese, okay, will survive, okay, and they'll be able to fight and fend for this. Now, of course, here, my patients, we preach and promote, optimizing vitamin D, vitamin C, zinc, quercetin, good gut health, obviously probiotics, curcumin. There's a lot of things we use here, okay? And they're not way off the charts, like kind of they're obvious stuff that's been studied and well accepted now that we're, 7-8 months down the road of COVID-19. So, this is real stuff. This is real data. We need a paradigm shift in the healthcare system, that we work on weight loss and type 2 diabetes. More than 30% of the country is type 2 diabetic. Studies show that another 30%, that means a total of 60% of the whole country in the US, okay, is type 2 diabetic and don't know it, meaning they got A1Cs that are average blood sugars that are above the acceptable range. So whether they know it or they've been to their doctor, they're on that spectrum and on that lineage of going towards diabetes. And these are all healthcare risks, including things that affect your immune system and really, really impact our overall medical healthcare system, and bog it down and jam it down and cost billions of dollars, and people suffer. And really why? I mean, it's just really poor education and poor approach in the medical system. What works is really functionality and personalized approaches in treating individuals like they are individuals, and listening and being an advocate for yourself and having a good relationship with your practitioner. That's where things matter and where the rubber hits the road and change happens. But I empower you to really, really look in the mirror and work on your diet and gut health and your weight. And if you're anywhere near type 2 diabetes or pre-diabetes or insulin resistant, come see a personalized functional medical practice like ourselves here at Longevity Health Institute, or find somebody in your area. We do telemedicine, just so you know, even for new patients around the country. I have patients all over the country, but in your area, you can look around. I can actually share with you even some websites where you can look up practitioners like ourselves, and one is worldhealth.net, and find a practitioner in your area that really takes a insightful approach and really digs into who you are and what you need to get your weight down and get your sugar and diabetes under control and prevent aggressive infections overtaking you and your immune system like COVID-19. So this is pretty alarming. I know you know it. I know you've heard it. And even here, of the hundreds of patients that we've had here with COVID-19 as our patients, and we treat by telemedicine and over the phone, and really coach them and work with them in their immune system and alternative therapies if needed. the ones that have been hospitalized and really ill are basically obese type 2 diabetics. So think about that, and please share that, because going forward, whether we're talking 2021 and 2022 or 23, COVID-19 is not going away. H1N1's still here, and we have to understand what it is and build our immune system and take a different healthcare approach, okay? And so that we can help each other and help loved ones and really change the medical approach here, okay? So hopefully this is educational and enlightening and motivating, because I'm just trying to motivate you, okay? Get out there, move, eat right, eat more plant-based foods, be active, okay? And encourage each other and be your own advocate. But if you need, accountability, get a partner, a friend, a loved one, start being more physically active, get off the couch, get outside. I don't care if it's cold or not. Okay, be active. Okay, you can do it. We can bundle up. Eat right. Eat real whole food. Don't eat processed food. Eat less animal products, okay? But high protein, okay? And love each other. Watch fun movies, laugh, comedies, okay? Share goodness and wholeness, and even if it's by Zoom and, telephone calls and FaceTime and all that, okay? Connect with each other, because that's real important. You heard me talk about the blue zones before. The blue zones are real important. Those are areas that people live the healthiest and the longest. Look it up, read stuff about the blue zones, because that's real. And, what do? They live soundly, wholly, they connect, they socialize, they eat whole food, okay? They're not obese, they're not diabetic. So this is Dr. Lewerenz, Longevity Health Institute. Our doors are always open, whether you're coming in or social distancing, and we're doing the right protocols and protecting you. We actually have viral air scrubbers. We have all the protective gear, etc. We do what we can to protect you and my staff and ourselves, but we do telemedicine, and we are always accepting new patients, me and my practitioners, and happy to help and to get your weight down, get your diabetes under control, and build your immune system. Think about it. This is Dr. Lewerenz. Be well.